Hello everyone, welcome to JPro Podcast. And today we're going to talk about chiropractor. Do you know what is chiropractor? I don't think you heard this word a lot, but I'm sure that you see a lot of video in Facebook or YouTube, like some guy cracking their neck and their body. I'm very lucky to invite one of my best friends. Let's welcome Dr. Vic.
Hi guys, it's nice to be on James' show, James' podcast. Sorry, I'm Vicknesh. I'm a chiropractor based in. I was previously based in Miri, and that's how I met James. But now I've moved back to where I'm from, which is in West Malaysia, from Selangor. And I've been practicing for about almost 5 years now, and I'm currently based in a clinic called the Backroom Chiro in Kajang.
All right, nice. It's good to see you. Like I said just now, I think a lot of people they don't know what is chiro. So can you tell us about what is chiropractor? It is quite new in Malaysia, right?
Correct, it is. So basically, what chiropractic is, to break it down, is chiropractic. Chiro is meaning hands, and then practic is practice lah. So meaning it's actually, if you break it down, it means hand practice. So we are treating people using our hands. And what chiropractors do mainly is we focus on adjusting the spine. That's the main goal of chiropractors lah. We treat the body based on, because we believe that the body is like a car. I'll always talk about cars because I like cars lah. So the body is like a car. It will run out of alignment, and for us chiropractors, what we do is we use our hands to put the spine back into alignment. So that's what we call adjustment. So I'm sure you guys have seen some of James' video where I've adjusted him before. It sounds scary, it sounds painful, but it actually isn't. It's actually quite comfortable and relaxing. Now, what do we mainly treat is things to do with anything to do with muscle, bone, joint, ligament, nerve, all these kind of things. Because why? We believe that the spine is the main thing in the body. It's like all your nerves and all go through your spine. So your nerves is your main thing. So if we get your spine moving correctly, your nerves are going to be working properly, and all your body's function is going to work properly. Okay. Now, the reason why a lot of people didn't know about this is in Malaysia is probably because of the exposure. It's like how pharmacies were 20, 30 years ago. A lot of people didn't know, and then slowly it started to grow. But if you look at like places like US and UK, Australia, there are a lot of chiropractors, and a lot of people know what's chiropractic. It's like how you go to the pharmacy to buy Panadol, they will say, my back pain, I'm going to go see the chiropractor. So like that. So the reason why, probably because it's starting to get popular in Malaysia, is because maybe, I think mainly it's because of IMU, the university, International Medical University. They started the course. That's where I graduated from also. So when the course started, a lot of people, what is this course? So a lot of students started studying it. And then when they studied and they graduated and they started working, and a lot of local chiropractors started coming up, more and more people started knowing about this. And what's happened is, I think Malaysia has gone from just like a few chiropractors now to about 300 to 400 chiropractors in Malaysia, which is still very new. And I think chiropractic in the next 15 to 20 years will be like what pharmacy is. You will find a lot of chiropractors everywhere in Malaysia.
I see. Really, because I remember the first time I met you, and then when you introduced me, and then you tell me what you work for, I was like, what is that?
Correct.
Yeah. Okay.
Because I think a lot, why also it's starting to get popular is because a lot of people are realizing like small thing, they don't need to take medicine, and they don't need to do any operation or anything like that. So if we can help, so that's why a lot of people are looking for other treatment options, and they find that chiropractic helps. So that's why I think it's gaining popularity in Malaysia.
Really true. Okay, so because I am a badminton coach, so a lot of parents, I think especially in Miri, I think you experienced this before. A lot of parents actually, they don't really trust chiropractor. So can you tell us like why do athletes need to like go see you, and then why we need to go see you?
Okay, good question. Okay, again, we talk like car lah. Okay, if a car you got no problem, would you service your car?
Yes,
Yeah.
true. Yes.
Correct. Because why? You don't want your car to have any problems. You want it to work properly. Okay. So it's similar to the body. When you talk about the body, like I said, you will do a lot of things and you sometimes fall, or for example, I like at badminton, we talk about badminton. If you go, let's just say you play 2 hours of game, you are swinging your, let's say you're right-handed, you're swinging your right hand like maybe 200 times during these 2 hours because you only use right hand. So there itself you can see you're using your one side more than the other side. Automatically got imbalance there. So just like how you brush your teeth every day, you brush your teeth because why? You don't want it to become bad. You don't want all the teeth to become ugly and stuff like that. That's why you brush every day. So the spine is also like that. You need to look after it so that in the future you don't have any problems. So now when you're young, of course, you don't see the problem. They are young, they're still very active, and the spine is something you cannot see. So that's why a lot of people, they don't think it's important until, wow, I got pain, something is not right, then only they go and see. Chiropractic is actually more of preventive care rather than curing a problem.
I see. Okay, so just now you mentioned about like because we swing like for example badminton, like maybe we swing like 200 times per day. So how often should athlete visit you?
Good question also. Now that will be very difficult for me to say because it is based on each person. It depends on the person. If the person is more active, always carry heavy things, do a lot of sports, all these kind of things, then I would see them more often. But just for example, okay, I am seeing one of the junior gymnasts Malaysia team. So for her, because she trained like 5 to 6 times a week, which is a lot, and she's young, so we need to make sure that her body is moving properly. She's got no misalignment, no pain, and everything. I see her once in 2 weeks. That means twice a month, but like some normal people, or those who do training maybe 2-3 times a week, I can see once in 3 to 4 weeks. So if they got no problems,
It really true because like the more often you use your body, the more often that you need to go and check out. Okay, so speaking of like a lot of parents like don't trust about chiropractor, but they do trust about the like so-called Chinese style. And then I see you doing the needling also, and then I see you do it like the way you do it and the Chinese style do it is so much different. Like for example, you will go in and out, like try to find, I guess, the muscle, the spot. But for the Chinese style, they just leave it there and then like I don't know, wait for 30 minutes.
Right.
Because I never tried before. So like what is the difference?
Okay, so Chinese style they call it acupuncture, and then the Western style, like the chiropractors and the physiotherapists we call it dry needling. So what is the difference is, to be very honest, I cannot comment so much on the Chinese style because I don't know so much about what their purpose is, but based on what I studied so far, just about a little bit, is like they follow the chi flow, energy flow, is it? Yeah, the energy in the body, and they will see they believe that for the liver is near the shoulder, for a few other places is this one, the stomach is always in the ear or something like that. So they believe like that. So that's why I think they do it. So they put there and then they leave it for the energy to balance out. That is what I understand so far. But our style, the Western version, what they do is basically when they do dry needling is because they find that the muscle is not working properly. It's either one, the muscle is too tight, or the muscle is not functioning properly. So when we go in, remember how I do for you, I play, you will feel the muscle jump, a bit pain but after that you won't feel the muscle jump anymore, correct? That means we reset the muscle already. So the main thing is we see the body moving like this because this muscle tight, because this muscle not very lazy. So we will treat that muscle with the needle, go in, reset the muscle, and we come out.
I see. Because basically, since young until the day I met you, it's like no one tell me it's like how like this situation. I always go to see like those Chinese one. I would just say, oh, my hand pain. So they just do a treatment just do a treatment. They asked me to rest 2 months. So I was pretty confused. Like I don't know what to do. Yeah, but I think you are more like detailed because you will tell me how I get hurt and then how you're going to treat me and then what should I do in process. Okay, so speaking of like just now we mentioned about how often we should visit a chiropractor. So in what situation we should visit you? Like only during injury or before that have to? I think it's before that, right?
So like normally what I recommend, normally like in Malaysia currently what I see the trend is they will only come in when they have pain, and then I will see them like maybe once a week until they are okay. And then when they're okay already, that's when I educate them. I say, okay, you need to sort of do this maybe once a month, like maintenance lah. You come in. So that's when they will come. So slowly, I think Malaysia, the people will slowly start to move from I got no pain, so I don't need to do anything, to I got no pain, better I take care of myself now. So I feel slowly they will move to that lah. But if you're asking me when to see, before you have any pain itself, you should go and get yourself checked in with a chiropractor, because if you've never been adjusted, 99.9% of the people will surely have some misalignment in the body.
True, also because how we sit, how we sleep, and everything that surely will affect us. I got one more question. Is like physio and chiropractor. It's like
So like who do they go to? You're asking like whether chiro or physio, is it?
Yeah. Like I mean, also what is the difference? Like based on what you know.
Okay, so if you ask me, if you've got no issues, you can go to both a chiro and a physio. Both of us are good. Okay, we both are physical therapy, meaning we treat you physically. But the difference between a physio and a chiro is probably, what is the main difference is, physio, I think they focus more on like muscle and rehabilitation. Like, okay, what do you do to retrain the muscle, all that. Chiros also do that, but maybe what we focus a bit more on is, like I said, spinal adjustment. We focus on adjustment more than physios. But if you ask me, is there a huge difference? Probably not so much. It's just that we focus more on adjustment.
I see. Then I think you both should like work together. Then it will be a perfect match, right? Because one side is focused on spine, and then another is more on muscle, how to rehab,
Correct.
right? Yeah.
Because I think most chiropractors they see quite a number of patients, so they don't really spend a lot of time with the patient. So like remember the old clinic I was in, I will see patient, I will see what the problem is, I diagnose, I will see where they need to do, I'll adjust, I'll do some needling, then I send them to the physio to really spend time and work with them.
True. Yes, I remember that. Because that's where I find it like, this is like I have been looking for like the professional place. Like because like I said, I always don't know what's wrong with myself. But the doctor just asked me go back and rest for 2 months.
Correct.
Okay.
I wouldn't say the Chinese practitioners are not professional or bad. Some of them are really good. It's just that I think that because we have the medical knowledge and we are trained in uni itself to explain to the patient so they understand what it is. So that's why I think, you will feel like, okay, I know exactly what's going on when you see a chiropractor.
Yeah, I think also because chiropractor all go to uni, and then so you guys have practiced the presentation skill, communication skill, and then also public speaking. So where they learn, they always learn from someone who is very good, but they did not practice like how to speak, how to tell, like public speaking, things like that, how to communicate. So I think yeah, they are good, but they are just not good enough in public speaking and communication, and let all the patient know what happened. Okay, so we will have last question for today.
Okay.
Okay, so because we always see somebody injured on the court, and then we always don't know what to do. So like we don't know if we should carry him or her out, up, sit down, or just sit on the floor, don't touch, and like any kind of emergency things we can do to prevent the situation getting worse.
Oh, okay. So, like what to do when a player gets injured lah. So for like badminton, what I normally see, the most common one is ankle, knee, or shoulder. These are the three things that I will see like usually. If like you are starting to get some pain, like it's not like suddenly like I swing suddenly wow pain like that. It's like I play, it's like a bit of pain lah, but I can tahan. But lah, some people a bit pain also they'll still play ma. Okay, in that kind of case, I always will tell my patients, as soon as you feel pain, that is like a signal. Same like a car again lah. When you feel pain, it's like your driver. This one it will show the signal, something not right, the engine sign. That is a sign that something is already not right. So if you're starting to feel a bit of pain, I would recommend you to go and get it checked. That's number one. Okay. You can still play lah, but okay, like some situations, because I treat a few athletes, I also understand, because in the middle of competition, takkan you reach quarter-final, semi-final already, you suddenly say, I got a little bit of pain, I don't want. You can play if you can tahan the pain, but make sure you put a lot of ice. Put ice. That is one. Okay. Now, if just say you play and suddenly you get a lot of pain, but you feel after that, maybe not so pain, I can play. Don't do that. If you feel suddenly got pain, stop. That is a sign something happened, because sometimes the body is very funny one. It will work in a way to protect yourself one, where actually something injured already, but your body numb the pain because it don't want you to feel pain. So actually it's already injured, but you don't feel pain, and then you go and play, you get more injury. So if you feel sudden pain, I always will say, stop immediately. Don't do anything. Straight away put ice on it. Always when you kena all this type of injuries, it's always good to ice. So for example, most of the time badminton, the sudden like injury I see is either they fall, or the ankle sprain, or the shoulder suddenly got pain. All this, just put ice. Just put ice. If the ankle sprain is very bad, until they cannot get up, let them rest first. Then slowly help them and can move them lah. So that is like that lah.
Okay, I see. Yeah, because we always don't know what to do when they're injured. Like, yeah, like as a coach, I will be panic, and then I don't know like if I should do it or not. Especially the one you just mentioned is like if they feel a little bit pain during the competition, like you said, Takang, we stop it. Yeah, but now I know it's like if they feel like really like pain, like sudden pain, very pain, yeah, then we should stop it. So like, okay, additional question. Okay, this is for myself. So last time I was in the competition, but I'm not the one who injured. It's my teammate. Okay, and then after he plays semi-final, and then he managed to win, and then after that match, his shoulder cannot even lift up anymore. Cannot even lift up. And then suddenly, got one China Physio or Chiropractor, I don't know. I forgot already because I was so young, and then I don't really care about that thing because I got my match to focus. And then she helped him to adjust. I think it's adjust lah. And then after that, next day my teammate, his hand is like brand new already. It's like straight away can smash straight away. It's like why is this possible? Like, yeah, like based on your knowledge, yes.
Based on what I hear, what I feel happened was maybe his alignment wasn't good, or his muscles weren't balanced, and that's why he's having pain, and the shoulder can't move. And maybe when she adjusted it, everything now can move properly. The muscles are relaxed. That's why he can move properly. So that's what I think happened lah. So most of the time, if you have an injury, you can always take and see a chiropractor. If he feels like, hey, this is something very serious, maybe like bone break or full ligament tear, then he may refer you to go and see the doctor or whoever lah.
Yeah, I see. So it's best is like if really like us like coaches, like if we really worry about it, then we just take the student, take the athlete, go to see chiropractor to be sure like if we can continue or not. That is the best way lah.
Yes, agreed.
Yeah. All right. That's all for today. I hope everyone enjoyed this podcast and then also solve all the question that you have about chiropractor and then why we should see chiropractor, things like that. So thank you very much and all the best and stay safe.